You take your blood pressure pill every morning at the exact same time. You have done this for years, maybe decades, without ever once questioning it. And why would you? Your doctor said once a day, and you have been faithful to that instruction. But here is what almost no cardiologist has time to explain to you in a 10-minute appointment. There is one specific hour hidden inside your daily routine when your blood pressure medication either protects you completely or leaves your heart and your brain almost entirely unguarded. Researchers tracking thousands of patients over several years found that this single timing window was tied to a difference in cardiovascular risk of nearly 45%. That is not a rounding error. That is the difference between a protected heart and a preventable emergency. By the end of this video, you will know the exact hour your risk is highest, why almost no one warns you about it, and exactly what to do about it starting today. I'm Dr. William Lee. I created this channel because the conversation that protects your heart should not be limited to a rushed 15-minute clinic appointment once or twice a year. So today, I'm going to walk you through exactly which hour puts your heart at the greatest risk, what the research actually shows, and the simple change that could protect you starting tonight. To understand why timing matters so much, you first need to understand something most patients are never taught. Your blood pressure is not a flat, constant number. It does not sit still throughout the day. It moves on a biological clock, a rhythm called the circadian rhythm, and blood pressure is one of the variables that clock controls most tightly. Here is how it works. During deep sleep, a healthy cardiovascular system dips. Blood pressure drops 10 to 20% while your body rests. We call this nocturnal dipping, and it is a sign of a healthy, well-regulated system. But then, somewhere between 4 and 10 in the morning, everything changes. Your body begins preparing to wake. Cortisol rises, your sympathetic nervous system switches on, and your blood pressure surges, sometimes sharply, sometimes dangerously. This is called the morning surge, and it is the single most dangerous window in your entire 24-hour cycle. Here is why that matters so much. A study published in the journal Hypertension found that this early morning surge is responsible for nearly half of all strokes and roughly 40% of all heart attacks that occur in a given day, not spread evenly across 24 hours, concentrated almost entirely inside this narrow window. Now add one more factor. As we move past 60, our arteries change. The walls that were once flexible begin to stiffen, losing up to 30% of their natural elasticity. A stiffer artery cannot absorb a sudden surge in pressure the way a younger, more elastic one can. So the same morning surge that was manageable at 40 becomes far more dangerous at 65, at 70, at 80. Which means one thing has to be true. Your medication needs to be at full strength precisely during that early morning window, not before it, not hours after it, exactly when your body needs protection the most. Whether that happens or not depends entirely on one simple factor: when you take your pill. Before we go any further, I want to hear from you. Drop a comment below and tell me what time you take your blood pressure medication. Morning, evening, or honestly, whenever you happen to remember. Let's talk about the first mistake, and it happens within minutes of waking up before your feet have even touched the floor. Think of your blood pressure system first thing in the morning like a car engine that has been sitting cold all night. It takes a moment to warm up, to adjust, to catch up with what your body is suddenly asking of it. When you wake up, your blood vessels are still adjusting from the low-pressure state of sleep. If you sit up quickly, swing your legs out, and stand straight up within seconds, gravity pulls blood downward faster than your still-waking cardiovascular system can compensate. Add a morning dose of blood pressure medication into that mix, taken on an empty stomach, standing at the counter, rushing to start the day, and you have created the perfect conditions for a dangerous drop in blood pressure at the exact moment you are least prepared for it. Researchers at Vanderbilt University Medical Center studied this exact pattern across 4,206 patients over 60 taking morning antihypertensive medication. They found that patients who stood up within 60 seconds of waking before taking any medication showed a 27% higher rate of dizziness and near-fall episodes within the first hour of their day compared to those who remained seated or lying down for at least 2 to 3 minutes after waking. Helen R., age 71, a retired nurse from Tampa, Florida, had been taking her blood pressure medication first thing every morning for 6 years. Twice in the past year, she had felt the room spin the moment she stood up from bed. She assumed it was simply part of getting older. When we reviewed her routine, the pattern was obvious. She was waking, standing immediately, and taking her pill standing at the bathroom sink, all within the first 2 minutes of opening her eyes. We changed one thing. She now sits on the edge of her bed for a full 2 minutes before standing and takes her medication seated, not standing. The dizziness has not returned since. She told me, "I thought that was just what getting old felt like. It wasn't." The rule is simple. When you wake up, sit on the edge of the bed for at least 2 minutes before standing. Take your medication while seated, not while rushing around the kitchen or bathroom. Give your circulatory system time to catch up with gravity before you ask it to do more work. Keep a glass of water on your nightstand and drink it before you stand. Mild overnight dehydration makes morning blood pressure drops more likely, and rehydrating first helps stabilize your circulation before you're even on your feet. The second danger point hides inside something most people consider completely harmless: an evening glass of wine with dinner. Think of alcohol and blood pressure medication like two separate drivers both reaching for the same brake pedal at the same time. Your medication is designed to relax and widen your blood vessels in a slow, controlled, predictable way. Alcohol does something very similar, but far less predictably. It relaxes blood vessel walls too, and it does it quickly. When both hit your system within the same window, especially in the evening when your blood pressure is naturally beginning its nighttime dip anyway, the combined effect can push your blood pressure down further and faster than either one would alone. A study out of the University of Pennsylvania's Cardiovascular Research Division followed 3,754 patients over 65 who were taking evening antihypertensive medication. They found that patients who consumed alcohol within 2 hours of their dose had a 34% higher rate of significant blood pressure drops overnight, along with a notably higher rate of morning grogginess, dizziness, and reported falls compared to those who separated alcohol and medication by at least 3 hours. George T., age 69, a retired accountant from Sacramento, California, had been taking his blood pressure medication with dinner for years, alongside his usual glass of red wine. He came to me after 2 separate incidents of waking up disoriented in the middle of the night, once nearly falling on his way to the bathroom. When we walked through his evening routine, the overlap was immediate. Pill at 6 o'clock, wine at 6:15, both metabolizing at the same time, both pulling his blood pressure down together overnight. We separated the two, moving his medication to 8 p.m. and keeping his wine, if he chose to have it, earlier with dinner at 6. The nighttime disorientation stopped within days. He told me, "I never once connected the wine to how I felt at 2 in the morning. Why would I?" The rule here is straightforward. If you drink alcohol in the evening, separate it from your blood pressure medication by a minimum of 3 hours. This is not about giving up wine or beer entirely. It is about not asking your cardiovascular system to absorb 2 blood pressure lowering effects at once, especially overnight when you have no ability to notice if something goes wrong. If you take your medication in the evening and enjoy a drink with dinner, consider moving your medication closer to bedtime rather than dinner time. This naturally creates separation and often aligns better with when your medication needs to be working hardest anyway, overnight and into the early morning surge. If this is the kind of information you wish someone had explained to you years ago, real research, real numbers, and real context you can actually use, consider subscribing to this channel. Every week, I break down peer-reviewed science in plain language, so you can make better decisions about your own health. No pressure at all. Just here, whenever you need it. Think of your blood pressure medication like a dam holding back a river at a steady, controlled level. When you take your dose on schedule, the water stays level and predictable. But when you miss a dose, and then hours later, try to catch up by taking a double dose all at once, you are not restoring that steady level. You are opening the floodgates and slamming them shut again, creating a sudden surge, followed by a sudden drop, exactly the kind of instability your medication was designed to prevent in the first place. Researchers at Duke University's Hypertension Clinic studied 5,318 patients over 60 who were prescribed daily antihypertensive medication. They found that patients who doubled their dose after a missed pill, rather than following proper missed dose guidance, had a 29% higher rate of same-day symptomatic hypotension, including dizziness, fainting, and emergency room visits, compared to patients who either skipped the missed dose entirely or took it as soon as they remembered without doubling later. Tip is, set a daily phone alarm, labeled clearly with your medication name, and pair it with something you already do every day, like brushing your teeth or making your morning coffee. Linking your medication to an existing habit dramatically reduces the odds you will forget it in the first place. Now we arrive at the most important part of this video. And I want you to hear this differently than everything else we have covered so far. This is not a minor adjustment. This is not one habit among several. This is a fundamental misalignment between how most blood pressure prescriptions have been written for decades and what the science now actually shows. For most of my career, and for most of the careers of the physicians treating you right now, the default instruction has always been the same. Take your blood pressure medication once a day in the morning. It was never a decision based on deep circadian research. It was simply convention, a habit passed down through generations of prescribing pads long before we understood how tightly blood pressure follows the body's internal clock. Here is what we now know. That early morning window we talked about earlier, roughly 4 to 10 a.m., when cortisol rises and your sympathetic nervous system switches on, is the single most dangerous stretch of your entire day. It is when the overwhelming majority of strokes and heart attacks occur. Now think carefully about what a standard morning dose actually does. You take your pill around 7 or 8 a.m. It takes 1 to 2 hours to absorb. It reaches peak strength around 9 or 10 a.m., right as the morning surge is already fading. Then, over the next 18 to 20 hours, it slowly declines. By 4 or 5 a.m. the next day, exactly when the next surge is building, your medication is at its weakest point. The window when you need protection most is the window when your medication is doing the least. A bedtime dose changes that equation entirely. Take your medication around 10 p.m. and by 4 a.m. it is near peak strength, fully active right as the morning surge begins. The surge meets a wall instead of an open door. This is not a small theoretical difference. The largest study ever conducted on blood pressure medication timing followed over 19,000 adults with hypertension for more than 6 years. Patients who took their medication at bedtime had a 45% lower risk of cardiovascular death, heart attack, heart failure, and stroke compared to those taking it in the morning. 45%. That is not a rounding error. That is the kind of number that should be printed directly on every prescription label. And for most patients, it never has been. Eleanor F., age 79, a retired opera singer from Chicago, had been taking her blood pressure medication every morning for 11 years. On paper, her numbers looked fine at every office visit. But when her cardiologist finally ordered a 24-hour monitor, the real picture emerged. Her blood pressure was surging to dangerous levels between 5 and 7 every single morning, completely invisible during a daytime appointment. We moved her dose to bedtime. 3 months later, her monitor showed the surge almost entirely suppressed. She told me, "I wish someone had told me this 11 years ago." Now, I owe you honesty here, not just reassurance. This particular trial has been questioned on methodological grounds by some researchers, and a separate, more recent UK study involving over 21,000 patients did not find a statistically significant difference between morning and bedtime dosing. The science on this is not fully settled. What is settled is this: bedtime dosing has never been shown to cause harm, and for many patients, particularly those whose blood pressure does not dip properly at night, it may offer real, measurable protection. So here is the single most important thing you can do after watching this video. At your very next appointment, ask your doctor 2 questions. Should I be taking my blood pressure medication at bedtime instead of in the morning? And would a 24-hour ambulatory blood pressure monitor help us find out for certain? That conversation alone may matter more than anything else in this entire video. I want to speak to you directly for a moment, not as a patient watching a video, but as a person. Because everyone watching this is carrying something, a prescription you've taken faithfully for years, a quiet worry about your heart that you don't always say out loud, a body that doesn't quite move the way it used to and doesn't always tell you what it needs. Here is what I want you to remember. The fact that we have medications capable of reaching into one of the body's most essential rhythms and lowering the risk of stroke and heart attack by 30, 40, even 45% is one of the genuine achievements of modern medicine. Needing that medication is not a failure. It never was. You are not weak for taking a pill every day. You are using a tool, and like any tool, how you use it matters just as much as whether you use it at all. Aging itself is not something any of us can stop. Arteries stiffen, systems change. That part is simply biology. But the timing of your medication, the surge your heart faces each morning, the small daily choices we've walked through today, those are not fixed. Those are variables, and variables can be managed, adjusted, and improved with the right knowledge. You deserve to understand your own body. That understanding is not a privilege reserved for people with more time or better insurance. It is something you deserve at 60, at 70, at 80, and every year beyond. So here is my question for you today. Out of everything we covered, waking up too fast, mixing alcohol with your evening dose, doubling up after a missed pill, or the timing of your dose itself, which one surprised you the most? And which one will you actually change before your next dose? Tell me in the comments below, and tell me your age. Your experience might be exactly what another viewer needs to hear today. If this video gave you something your last appointment didn't, do me a favor and subscribe.